Hello, this is Sydney White. Today I'll be talking about my reflection on case study 5.1. The scenario that we were presented this week is as follows. Your client is a 56-year-old male who has talked with you over the phone prior to a session in order to set up an appointment with you. On the phone, he has struck me as suspicious and seemed to be interviewing me with cautiousness, thoroughness, and a sense of mistrust. These were the underlying emotional themes picked up in the first 5 minutes of the conversation. He has described his situation as urgent in terms of a relationship ending. That means a lot to him. You respond to this urgency by scheduling him for an appointment later on in the day, since one of the appointments has been canceled, so that he can come in at that time. Okay, the first special population, there are three. First was as an individual, the second is as a group, and then the third is as couples or family. So the first situation I'll address is as an individual. So during this session, as an individual, it is brought to my attention that he has definite problems trusting others. He's quite defensive. There's evidence in the counseling session for post-traumatic stress disorder, PTSD, that has basically been untreated. And that leads me to believe that that is being stirred up by the relationship breaking up, enhancing his level of mistrust and defensiveness, which is reaching an almost paranoid level. So in handling this client, it seems that he has a lot of mistrust, a lot of defensiveness. And so I would begin our sessions by making sure that he feels like he's in a safe space. So with PTSD and with feelings of mistrust, a lot of clients feel as though they are uneasy. And so that would be my general priority number one, is making sure that he feels comfortable enough to where he can elaborate on these things, and we can start to dive deeper. If he feels general mistrust towards me, then it's going to be really hard to make progress in those sessions. So building that rapport with the client will help in his healing process. Until that rapport is built, there's going to be definite defensiveness and pushback from him, especially if I push too hard in the beginning. In Miller in chapter 5, before he speaks about the top 10 practical suggestions, it is definitely talked about in the fact that sometimes there is a push and a pull between the readiness for change between a client and a counselor, and that counselors can do a dance, so to speak, between the client and the counselor, making sure that they're building up that rapport before the client is able to do what you need them to do in order for them to grow. So again, my first priority with this client would be to lower his stress level in the present moment, talk about that breakup, but really just develop the relationship so that we can start to move forward and he can start to get some healing. The second special populations would be in a group setting, so same client, but in a group setting. So it says you have your client join a group that I have that evening based on the brief intake from the group you did earlier in the day. Your client sees appropriate for the group, which is focused on the loss of relationships. In this mixed gender group, he begins to cry almost uncontrollably as other members discuss their losses in the relationship. He is having difficulty sharing words with the group because of his mistrust with others and his history of PTSD, which he briefly disclosed to the group. So in this situation, in the group setting, it definitely would be talked at initially that the group we are all allowed to feel whatever we need to feel in that moment, and we all need to be respectful of each other's emotions and feelings. Um, in respect to this particular client, um, I would definitely take note of the uncontrollable nature of his crying, whether that is directly tied to the breakup or if that is a result of the PTSD. In this instant, because the breakup seems to be very fresh and new, it could be the breakup, it could be a mashup of the two, or it could be just a trigger for the PTSD and therefore it's manifesting itself in the uncontrollable crying. Um, with the tears, and if he is able to share even a little bit of his history, which he was able to share his PTSD, um, I would make sure to follow up with him and letting him know that anything that he can share is great for the group and for himself. That way he can get those feelings out into the open. He doesn't have to necessarily carry them internally any longer. And that the group in itself, they all have come from similar experiences, and maybe that he can learn something from one of his group members, or maybe one of his group members can empathize with him in a way that he didn't think of before, bringing him some type of comfort and further that trust from another individual, which would be big for him, since trust seems to be the root of the PTSD, the breakup, and the uncontrollable feelings. So that's the special populations group. Additionally, with the special populations group, I would want to make sure that the client also knows that he's in a safe space, and that his information is protected as much as it can be in a group setting. And that, again, we are all there for support. Okay, that's the biggest thing with the group setting. But again, that trust is going to be a key factor for him in his healing. Lastly is the couples and families special populations. So this is if I took this client and he unexpectedly brought his partner to the intake session, the first original session. During this session, they discuss how their breakup appears to be necessary and imminent. However, I have never interacted with my client's partner until this moment. While they both appear to be sad and angry about the breakup, my client is almost hysterical when discussing it, and the partner is more of the verbal of the two. During the discussion, your client shares a small piece of information about his history of PTSD, and you believe that the history is impacting his difficulty sharing and trusting in the session. That is also affecting the impact of the relationship ending. I've become aware that though the couple has been together a few years, that the client's partner's family of origin has never liked your client, and they have indirectly been unkind and mean-spirited towards your client in hopes relationship would break up. So, in the case that a client would bring a partner unexpectedly, that would definitely change the dynamic of the session. First off, we would have to discuss the fact that I'm treating the couple as the client, not the individuals inside of the client. That's a key factor that I learned in another class, is that as a marriage and family therapist, you have to establish that at the beginning. So I'm treating the relationship as a whole, or the past relationship as a client, not necessarily the individuals within the session. Now, I could have separate sessions with them on a later basis, which I think would be beneficial in this case, because there is so much detail-oriented things in here in this scenario. However, at the time, we have to treat what is in the present moment, which is the couple in itself. Secondly, I would talk about or ask the couple what is their goal with coming to see me today. Initially, I was planning on seeing one client, so what changed and how do they feel like I can help them in moving forward with this breakup. Um, Additionally, after letting them both speak, I would suggest that it might be beneficial to again have two separate sessions, one with the client and one with his partner, um, especially since the client is having issues with PTSD, issues with trust. Um, Again, the partner's family being unkind to him, which is further exasperating the PTSD and the mistrust. Um, and so dealing with him would be the key, I think, in this relationship. Um, I'm not sure whether or not this couple would want to try to rekindle their relationship or what their goal would be. However, it definitely seems like this individual has a lot of self awareness that they need to work on, and hopefully I can guide them to that. Um, are there any legal or ethical issues? Absolutely. With the group and the partner and couples family session, there's definitely confidentiality issues in that, because you have other individuals involved. So that would have to be brought up um, during the initial conversations of the session. Same thing with legal and ethical issues. For fear that for some reason someone discloses something that should not have been disclosed in a session, that could lead to some legal and ethical issues. Other than that, I think really focusing on the trust, focusing in on the PTSD, working on those two things and healing that client from those aspects will also benefit the client, not only in this relationship, in this breakup, but all of their relationships in their life. So that would be my main goal and focus, is building that rapport with that client, talking about that mistrust, talking about the PTSD, where that trauma stems from, where that mistrust stems from, and then working towards a better, healthier way of dealing with those emotions.